Thanks for being here this morning. It's the Mike Broomhead Show, and joining me now, United States Senator John McCain. Senator McCain, thanks for being here this morning.
Well, thanks, Mike. Thanks for having me on. It's good to be back.
Now, I want to ask you right out of the gate. I read the press release this morning about the passing of Senator Kennedy. Give you a chance to, if you have anything you'd like to say on his behalf.
Well, he was a giant in the Senate. He was there for many years. He devoted his life to the causes and the things he believed in. And one of the things that I admired about him a great deal, a little straight talk, his word was good. That's one of the most overrated aspects of the United States Senate. So if you made an agreement with him, he kept his word. He represented the liberal left, obviously in America and in the United States Senate, but he was willing to work together to achieve results. And I worked with him on numerous issues, including a lot of national defense issues, since we were both served on the Senate Armed Services Committee together.
Now, do you think that any of this is his passing? How is this going to affect this health care debate now, and not just losing the vote, but now his legacy or his memory? How does this play into this debate in the Senate, or does it not change the debate at all, do you think?
I don't think it changes it much because he's been absent for a long time. Okay. I do think that if he had been there, that there would have been serious negotiations. What has taken place so far has just been an effort to pick off one or two or three Republicans and call it bipartisan, right, the way they did in the stimulus package, which really is not
negotiating.
It's not negotiating. He seriously negotiated. What Senator Baucus and the White House are doing is not serious negotiations.
So let me ask you this. Now yesterday, the big quote everybody's hearing is you saying that you want to reform health care, you want to get something done. But
no public option.
Right. I agree with that.
No public option.
Let me ask you this. Why not, or what's the disadvantage to just letting this thing kill itself?
Because the Medicare trustees, the trustees that oversee Medicare in America, say that it's going broke, and it's going broke in a few years.
Okay.
The inflation and costs of health care in America are unacceptable. It's 1/6 of our gross national product. It's growing to 1/5 of our gross national product. Look, we could enact medical malpractice reform. That would save $100 billion. We could eliminate fraud, abuse, and some of the criminal behavior. That's about $300 billion a year. We could let people go across state lines and purchase the health insurance of their choice. We can design insurance that would encourage wellness and fitness and reward it, like Safeway does.
Right.
Look, there's a lot of things we could do to bring down the inflation in healthcare, which, according to the people who oversee the system, say the system's going broke. We don't want to do that to our kids.
No, and I agree with you, but I guess the question, here's how it seems to people, like a novice like myself that's not involved in the debate. What we see is a bill that we hate. We see the public option that they're pushing for. We see this huge new system that's going to look a lot like Medicare and Medicaid in the eyes of the people looking at it. We're saying right now it's dying on the vine. The American people hate it. The Democrats can't push it. Why not let this die so that they have to start over with what you are talking about? The idea of crossing state lines and deregulation and tort reform is what people want, but they don't think it's going to happen with negotiating with this bill. Is that true? Or
Well, look, I'm always ready to negotiate. Now, whether they will agree or not, I mean, the far left obviously insists on the public option. I insist that, and by the way, that's a bad phrase. It's government option. Yeah. Okay, it's government option. Have no doubt. It's not public. We're talking about federal bureaucrats running the healthcare system in America. But look, if they'll sit down and say, we'll do tort reform, we'll put incentives for wellness and fitness, we'll do this, fine. I'm always ready to negotiate. But I agree with you. This is a bad bill. I voted against it. I am opposed to it. But to say that we won't negotiate under any circumstances obviously flies in the face of reality, which is the system. Medicare is going broke, and so we have to fix it. Now, their fix is wrong, but there are things we can do. Look, a small example. Do you know what one of the huge costs is? Hospital readmissions, okay? That is people who leave the hospital and a few days later are readmitted because they're not totally well. Why is that? One of the reasons is that the insurance companies only will pay for a certain number of days in the hospital, so they discharge them early. Shouldn't we fix that?
Sure.
In other words, there's so many fixes that we could make in this system to keep it from going broke, because it should be there for our kids and our grandkids as well as us.
So how do we, when we look at this, we talk about the government keeping their hands off in a way. We want to get them out of the insurance business, get away from a lot of these things. How do you negotiate that with the numbers? You don't have the numbers right now. Nope. And the funny thing is, they can't pass it alone.
No, but Mike, is it appropriate? Well, listen, what I'm very worried about is this 51 votes thing that they may try to kick in, which, by the way, would destroy the institution of the Senate, because the Senate and the House are different because of requirement for 60 votes. Is it appropriate for me to say, look, we're not going to negotiate on anything with you? I'll sit down with anybody if we can fix the system.
Okay.
And again, I'd like you to look at the Medicare trustees who say, I think it's 2018. I'm not sure, but it's not that far away before there's no money left in the Medicare system. I'll call you back with the exact number, but and that year gets closer and closer every time the Medicare trustees make their estimates. But I am unalterably opposed, as you are, to a, quote, public option, government option, these effectiveness, comparative effectiveness boards, which then would, at the end of the day, decide and ration health care. By the way, in the committee of which I sit, we had an amendment that said we would not federally fund abortions. We lost that. We lost that amendment. Okay.
That was my next question.
That will be one of the biggest steps in many, many years. We have the so-called Hyde Amendment, which prohibits federal funding for abortion. They are reversing that.
So let me put
not acceptable.
Let me put myself in a spot I never put myself in. Let's say I'm one of the liberals in favor of this thing, and we are negotiating. You and I are.
Yep.
Now, there are some issues where we know in the House bill they've tried to put in that there's no bureaucrat's going to be between a medical provider and a patient. We know that the abortion part of that has been killed, on 9 different occasions between the Senate and the House. What's a deal breaker for you? When I want a negotiation, where do you give on this, and what is something that absolutely you will not give on besides the public option?
I won't give on a public option. I won't give on federal funding for abortions. I won't give on these comparative effectiveness bureaucracies. I will negotiate on medical malpractice. The trial lawyers control basically the Democrat Party. I'd be glad to negotiate maybe a package like California or Texas have. I'd be glad to negotiate on how we reimburse some of these and change rather than reimburse for specific procedures and specific tests for outcome-based treatment of patients. I'd be glad to negotiate on a number of other issues to improve the efficiency of Medicare and Medicaid. And by the way, if this bill passes, the bill for Medicaid on the state of Arizona is about $300 million additional. You tell me where we're going to find that money.
Absolutely.
I mean, the huge burden of Medicaid costs that is put on the states is remarkable. But look, I again say I will talk with anyone to try to solve this problem, but we cannot. I have a fundamental principle that government does not do the job in any kind of efficient fashion. Canada and England have systems that don't work, and I'm not going to impose that on the American people.
And see, that's where I think it was interesting, because I was not at the town hall yesterday, but hearing the audio from it, that there was people that were applauding when you talked about the health care costs and needing to bring them down. But it seemed to be where people were getting upset when the word negotiation came in there, because they don't want to even they want to see this thing just die. So that's what I wanted you to clarify. When you say negotiate, I understand what you're saying now, but at first it sounds like just let this thing die and go away, and let's start over and get something that's acceptable.
Well, I guess it's a matter of semantics. But every day that goes by, there's less money in the Medicare Trust Fund, and the situation becomes more acute. That's why I think we need to address it as quickly as possible. By the way, Social Security is going broke too. We need to address that.
And the president said he wants to
I'll be glad to sit down and negotiate to try to save Social Security too. I think that's our job as Americans.
I was a little
we have
scared.
the obligation.
The president said he wants to tackle Social Security next. So I'm a little nervous about that, too.
Well, by the way, I don't know if you saw the budget director said, well, when they said about taxing people only with incomes over $250,000, his answer was, well, we'll be coming forward with a budget soon.
Of course. Yeah. What a surprise that is.
$9 trillion deficit. The reason why people are upset, Mike, is not only because of this proposal. They are upset because we are staring in the face of a debt and deficit of unprecedented proportions. We have committed generational theft by laying a debt burden on future generations of Americans. And that's the backdrop for another $1 trillion to $2 trillion in costs in health care. We can't do this to our kids.
Now, Senator Feingold, let me just shift for a moment. Yeah. Senator Feingold is now being quoted as saying that he doesn't think there's going to be a bill this year and maybe never. Do you agree with that, or do you see this 51 vote, this reconciliation being a real possibility to get it done this year?
I don't know, because I don't know what the Democrats are discussing. I do know this, that if they go the 51 vote route, it'll have repercussions for a long, long period of time, because it will fundamentally change the institution. I fought, you might remember, and a lot of people didn't like it, I fought against the 51 votes for confirmation of a judge,
right,
because I wanted 60 votes to stand in the institution. I'll fight again to see that 60 votes remain.
Okay, now I know you only have a few minutes with us. Do you have time to take a phone call?
Sure.
Okay, let me look at one here. Let's go to Logan in Chandler. Logan, you're up first. Go right ahead, Logan. You're on with Senator John McCain.
Good morning, Senator.
Hi, Logan.
Hi. I know that Mike has already asked you about whether or not this bill is going to be resuscitated if the public option is taken out. But my problem is that there seems to be so much fixation on the public option that people are overlooking other aspects of this bill that should never see the light of day.
I agree. Like comparative effectiveness, like the federal funding for abortion, like a number of other issues.
Yes.
I think, when I say I'm willing to negotiate, we should start from square one. We should start all over again, but we should negotiate.
Okay.
Logan, see my point, Logan?
Yes, thank you.
Yeah, thanks,
all
Logan.
Right. Let me grab one more for you. Let's go out to Paul in Cave Creek. Paul, go right ahead.
Good morning, Senator. How you doing?
Fine, Paul.
Listen, I have a question. Among the many reasons I'm against this insane, disastrous bill is the cost of it. The country is totally broke. You talk about the Medicare going broke. Well, the country is totally broke.
I agree. You saw the latest estimates. They went from $7 to $9 trillion overnight over a 10-year period.
Yeah. Secondly, does anybody ever talk about the unconstitutionality of this? The many things in this bill?
We need to talk more about it. I believe that there's certainly questionably constitutional questions about it, particularly whether people are forced to accept government health care or not. That's a fundamental principle. But right now, they have the majority, and that challenge would come later if they pass it. Right now, we're fighting the fight to try to get these egregious and outrageous provisions stopped.
All right. Well, Paul, I appreciate
Thanks,
the phone
Paul.
call. And Senator, one last question about this. Now, when you discuss these things, when you go back now, when you talk the word negotiation, is there real momentum now for the Republicans? Because are the Democrats getting the hint that America hates this? All the blustering about it being astroturf and not a real grassroots. Do they really grasp how much the American people are against this finally?
I don't know. They've decided to counter-demonstrate our activities. I think they're probably figuring it out. Look, there's something going on in America, Mike. You hear it all the time, and you'll hear it after I leave this morning. Americans are deeply concerned and angered about the debt and the deficit and the intervention and movement of government into the private enterprise system in America. It is unprecedented. And the Tea Parties and the calls and the demonstrations and our town hall meetings, they all indicate out there's a real peaceful revolution going on out there. And sooner or later, the Democrats in Congress will get the message.
Well, and I appreciate you being so available to come in and talk with us in the town hall meetings, and that Congressman Shadegg and Congressman Franks being out there for the public to have access to. And again, thank you for coming in, clarifying your position, and spending a few minutes with us today.
Thank you very much.